Hey everyone, it's Dr. Charlotte Hodges, and I'm so excited to tell you guys about Obesity Care Week. It is a wonderful, fact-filled, week-long event to really get the word out about obesity and obesity care. And so, why was this week even important? And so, just to kind of give you some interesting facts about obesity, 30% of our annual healthcare costs are related to people when they're obesity-related conditions. We also spend $480 billion annually on obesity-related healthcare. There are actually 230 different diseases that are directly linked to obesity. And they say there's nearly 50% of the patients, so that's the estimated percentage of older patients affected by obesity in 2030 if we don't make any change today. And so, as a physician and as a provider in the field of weight loss, I don't usually have a difficult time talking to patients about their weight. Now, do I have some family members that are overweight? Yes. Do I personally have a very difficult time broaching that subject with them? Yes. I mean, my mom ended up having surgery. My brother had surgery. And it actually took them coming to me, not the reverse, before they were really ready to have the surgery. It can be difficult to have these conversations with your family members. And because of that, that's why it's even more important for providers to take that initiative. We have to change this shift in our thinking in what obesity is. We have to treat it like the disease it is. So, I thought this was interesting. And this is information directly from the Obesity Care Week website. It says, for too long, people with obesity have been stigmatized, which has prevented their effective treatment for their disease. Half of people with obesity report they never have had a conversation about their weight with their healthcare provider, and only 4 out of 10 patients say they've ever been counseled about their weight with their PCP. That's terrible. How can a disease be treated if we never even talk about the disease? And so the conversation about weight between your healthcare provider and their patients, it's certainly avoided for many reasons, but from what I've seen, from what the research shows, it's really due to lack of good sound science, good knowledge, and also weight bias. So that is what spurred Obesity Care Week. So to address this lack of good science-based, evidence-based medicine, the Obesity Action Coalition, the Obesity Society, the Stop Obesity Alliance, the Obesity Medicine Association, and ASMBS, the American Society of Metabolic and Bariatric Surgery, launched Obesity Care Week with a vision to create a society that understands, respects, and accepts the complexities of obesity and values science in clinically based care. Obesity Care Week will achieve this vision to change the way that we care about obesity by, and they list 3 different ways. Number 1, elevating societal awareness of the disease of obesity, those affected by it, its science and clinically based treatment, and weight bias. So the first thing, we want to raise awareness, and we also want to give good, sound clinical information for the treatment of the disease. Number 2, building a fact-based understanding of obesity among individuals impacted by the disease, healthcare professionals, medical societies, policymakers, payers, and other stakeholders. So we need to broaden the field of this information. It's not just the patient and their provider. There's so many more people that are affected and so many more people that need to be a part of this conversation. It's everywhere from the family members to our policymakers in DC and our state. They need to know the importance of obesity care. And finally, also the insurance companies, they need to see the value and coverage for these different treatment modalities. And then finally, the purpose of this week is facilitating a shift to science and clinically based treatments for those living with obesity. So, I really feel that it's this week really gives us an opportunity to bring to light every day this week an important topic surrounding obesity and the disease of obesity and what we can do to help out. How can we treat our patients the best? How can we help our families and friends? And how can we all just get a lot healthier? So today is our launch date. And if you go to obesitycareweek.org, so obesitycareweek.org, there's a wonderful website. It has lots of really, really good information. There's information for healthcare professionals, information for patients, for family members. It's jam-packed with great information, and I really encourage all you guys to go and check out their website. Follow them on their social media. I'll be posting different things every day this week about Obesity Care Week. So on the 1st, so tomorrow, we will talk about, the topic will be weight biased. March 2nd is obesity prevention and treatment. March 3rd is access to care. March 4th, World Obesity Day. March 5th, childhood obesity. And then finally, March 6th is Eye Care Day. So I really encourage you guys, follow along all this week. Look into this information. It's really, really a good time for you to get the best science-based information that's out there, because I feel like for too long, we've really just used anecdotal evidence. Like, my cousin's best friend said, you know, apple cider vinegar is good. I mean, we need to move away from those types of conversations to really knowing what does the science show, because that is what's going to give you the best long-term success. So I'm excited. Hope to see you guys here, and follow along.